We're talking to art therapist Kate Rothwell today. Hi, Kate. How are you?
Hello, I'm very well, thank you.
Wonderful. Kate, let's talk a little bit today about art therapy and children. What sort of conditions in children can be treated by seeking the help of an art therapist?
Right. An art therapist might be sought to work with a child for many, many varied reasons. And I'm just thinking that it may well be that the child's behaviour in a certain way is causing the adults and the carers around the child to have concern. Now, there could be many reasons for that behaviour, from perhaps neurological disorders that haven't been noticed in other ways. It may be that the child has early onset Asbergers or autism. It may be to do with bonding, that the parenting is not effective to support the child, and the child is very confused, and therefore it may benefit the child by developing a therapeutic relationship with an art therapist using art materials to express themselves. And given that any human expresses themselves through images first before words, this would be seen by the art therapist as the most natural way of communicating, particularly if the child is not able to use words. A child may work in a school with an art therapist or may go to an art therapist practice, but there are a lot of art therapists actually working with looked after children who may have been given up for adoption or fostering and may be really struggling with understanding relationships and understanding themselves. So it may well be that it's a more natural thing to actually make an image or express themselves through the art materials to try and understand that more, and also to help them feel safer and to feel held and to feel in some way looked after. And the art making is a very natural, non-threatening, safe way of doing that.
You mentioned earlier about Asperger's and autism. If I was worried about my child and I brought them to an art therapist, would you actually be able to diagnose those type of conditions?
I might have an idea from my experience and my knowledge of it, but actually by law, under the Health Professions Council, who state register art therapists, and that's what gives us the legal title, we're not by law able to give a formal diagnosis. So what I would then do is refer them to a child and adolescent psychiatrist, and I would give them my thoughts on my experience of the child, and they then by law are able to diagnose that. But psychiatrists find it very helpful if they're working with specialist clinicians to give more accuracy to the diagnosis.
Tell me a little bit about what would happen in an art therapy session with a child.
Well, the very first thing is actually getting the child into the room, and that's the most important thing. And then it's very likely that the art therapist will give the child some information at the level that the child can understand about keeping safe in the room, keeping themselves safe and keeping the therapist safe, and a safe way of using the materials. And this is really to set the boundaries and ground rules so that the child has an idea of what it can and can't do. And this is all ultimately for the child's safety. The child, it will be explained to the child that they're meeting the therapist at a particular time and at that place, that the therapist doesn't change. And then they would be shown the art materials and possibly shown how to use the art materials. And ultimately, what the therapist is interested in is what the child is interested in. And if there's any of the materials that the child particularly likes going to. Now, that all sounds very, very healthy, in a healthy way, but there are many children who come in and may use, because of what they're trying to express, they may use the materials as weapons. So I've had children who picked up bottles of paint like this, ready mix that you can squirt out, and have then proceeded to squirt the paint everywhere. I've had children who have thrown clay. I've had children who have curled up in the floor in a basket and not wanting to wake up. I have children who've locked themselves in the toilet. I have had children who have stood in dustbins. These are children who are very confused and very disturbed and feeling unwell. And what I do is just try and keep the lines of communication open to let them know that I'm there. It's not about getting angry with them, but I will say, if you can't use the material safely, then I will lock them away until you can, and we will work in a way that you do feel safe with. And sure enough, 9 times out of 10, they get to a place where they can use them safely, and they go on to do amazing, amazing work. So for the therapist, the message is trust the process and just stay with the child. But we do not work beyond the boundary of the hour. That has to stop. And then over the weeks, over the time, then gradually we will come to a better understanding.
Do you try and interpret the children's artwork or not?
Absolutely not. Absolutely not. Again, it's for the child to show what they understand of it and to help the therapist understand it. What we might do, if perhaps they're drawing something maybe about mummy and daddy or a sister or brother or something, is to say, I wonder what it feels like being with them, or you're showing me something about them that may be telling me how you're feeling. How is that? So we're sort of asking open questions, but we're not saying, okay, you've drawn mummy and daddy and therefore I think that means this. That's not helpful. The person that's done the drawing knows better than the therapist what it's about.
What happens with a child who's not speaking though?
Well, it doesn't mean the therapist can't speak, even though it's a non-formal therapy. The therapist is speaking, and we're sharing our thoughts, but we're not interpreting. And many children don't talk. And in fact, many art therapists can be many art therapy sessions can be completely silent, and that's fine as well. But what we don't do is leave people in abject anxiety where they're frozen and paralyzed. So therefore, it may well be that they can't use an hour session and they have to build up to that. I also, and I know many other art therapists as well, will draw with their clients and say, well, let's play a game. Let's do something together. Let's take a line for a walk. Let's go and look at a book. Let's look at magazines. Let's cut things out. Let's stick things down. Let's see what's out the window. We really have a whole range of things that we can use. So we're not leaving people just staring at a blank sheet of paper.
Thank you, Kate. Thank you so much.